Thank you. My name is Catherine, and Aaron and I we were looking at a completely free market system of healthcare, as opposed to the proposed single-payer system, which would involve, rather than people paying their insurance premiums, they would be paying in a healthcare tax. And we don't like that, not only because tax is theft, and tax is not something that needs to be increased. If anything, it needs to be decreased as much as possible. The single-payer system, unfortunately, is not a plausible system. It gives the government much too much power. It takes away people's right of choice to decide what healthcare is best for them. And it increases taxes, and ultimately is a system that relies for efficiency and for saving money for the citizens. It relies completely on a very optimistic outlook that really isn't realistic. Recent single-payer system propositions have promised to save citizens between $3,500 and $5,000, but healthcare experts have weighed in that the only cost that people will have to pay is not just the healthcare tax, it is also higher deductibles and other miscellaneous costs that would be incurred. So the employers currently pay almost nothing for health insurance, as it's a fringe benefit of a larger package. So when a business owner buys health insurance for their employees, there are essentially the core benefits, and then health insurance is included as a side benefit, pretty much free of charge generally, is the way they structure it. But with the single payer system, the employers would not be paying for insurance anymore. They would, well, they're not now, but then they would be forced to be paying into the single payer system because they'd have to pay the health insurance tax. So at that time, the budget that they would have for their wages and for paying, for paying their workers and for providing other benefits to workers would be decreased. So essentially, with the single payer system, we're looking at a higher cost for the government to even implement the system, and then we're looking at our money being taken away from us on the back end. So it's an expensive plan for everybody. Furthermore, there's a website called Polifact that ran calculations of the envelope estimates for revenue on the single-payer healthcare system using 2013 tax data from the IRS. And they found that the single-payer system, at its current proposal, falls $600 billion short of what the US actually spent in 2013. Therefore, we would have to trim costs of healthcare 42 to 47%, while estimates of what could actually be cut come in only around 20%. And that's from calculations of Sherry Glide, a professor of health policy and economics at New York University. Ultimately, it means that the single-payer system is not possible or plausible in any way. And another person that weighed in on that was Kenneth Trope, who's an Emory University healthcare expert. He actually worked in the White House under Clinton, and he was noticing that the poor and the near poor would suffer the most from the single-payer system, and they would have to actually give up, they would be the people giving up the most of their wages, the most increased amount of their wages. So therefore, we're looking for a free market access with equal opportunity. We want to remove the subsidy of
1 minute
of all workers, and lower the income and payroll tax by an equal amount. We want to increase the affordability and accessibility of healthcare for all Americans and eliminate safeguards on insurance companies, because if the insurance companies do not fulfill their contracts with the consumers, then it would be in the consumer's best interest to sue them. Unfortunately, if the consumer has to get their health care from the government, and they have to sue the government is probably not going to rule in their favor. So we want to protect Americans from that as well. Thank you.
Good evening.
All right. Even though the Affordable Care Act, which was signed into law 6 years ago, has now reduced the proportion of Americans without health care down to 10%, it is still unacceptable that 10% of Americans are living uninsured. The way our healthcare system is currently set up is very expensive. The United States currently spends 17.1% of its gross domestic product on healthcare, which is more per person than any other country in the entire world. Even though it spends more money than any other country in the world, it is financially ruinous for many households, business, and government budgets. And it leads to very poor health outcomes. For example, under this system, we actually live shorter lives and receive much less of the care we need. Even though we are one of the richest countries in the entire world, we have the highest birth fatality rates of any other country with a healthcare system that spends the most amount of money. Currently, our healthcare system is extremely fractured because we have what is called selective health coverage. Some people belong to private insurance plans provided for them by their workplace. Others get public insurance through plans such as Medicare and Medicaid, and millions still are lacking insurance altogether. To have the healthcare system be more effective to society and more equitable to society, while yielding positive results towards the country, we must implement a single-payer healthcare system. A single-payer system is a healthcare system in which the government provides insurance for all citizens and pays healthcare expenses except for co-pays and co-insurance. Health providers may be public, private, or a combination of both. So while single-payer won't magically fix or may not magically fix the system of healthcare altogether, it allows for more people to have access to the healthcare coverage that they would otherwise be denied. Thank you.
All right, so we heard a lot about 10% of the United States uninsured, 17% of the GDP spent on healthcare. We heard a lot about it being more expensive for people and less accessible for people. We heard a lot about Medicare bad, Medicaid bad. And then we heard an idea about a plan facilitated by the United States government where it won't magically fix anything, but it's a good start in the right direction. Einstein said that the definition of crazy is doing something again to fix the same thing that was created by it. That's insanity. And this sounds like we're gonna ask the government to help us with health care even more than Medicare or Medicaid, which has a 100-year history of what? Mismanagement. When we talk about a free market approach, we talk about lowering the cost of everything because now there's competition. If the government's the only horse in town, how expensive do you think it's gonna be? Have y'all been to the DMV before? You know how long you have to wait in line? If Starbucks ran their business like the DMV is run by the government, you think they'd still be in business now? It's a rhetorical question. They wouldn't be in business. And so when we talk about healthcare being facilitated by the government, we have to talk about the record of success in this government providing accessibility and cost containment. We don't talk about, oh, if we fix this problem or we fix that problem, we need a new law, we need a new law. We already have laws, but we need less laws. But we need a market competition. We need market forces to correct an otherwise self-correcting system. But when we talk about social democracy and we talk about better plans abroad, it was mentioned a little bit, we're the number one country in spending and we're the number 1,000 country in actual health provisions, or providing health care to people. Well, the thing is, with social democracy, that's great, but we don't have a socialism of any kind in this country. We have a republic. And so furthermore, when we talk about socialism and the actual workability in the Congress right now, how fast do you think the Congress is going to pass a socialist program? I don't think they're going to pass it in the next 150 years. You know, when we're talking workability, when we're talking about actual solutions, we're talking about socialism being implemented by the Republican-controlled Congress, or restrictions like we have proposed being lifted on otherwise free marketplaces by a Republican-controlled Congress. So we win right here because the Congress is not going to pass this law, this single-payer healthcare system, but the Congress is much more likely to reduce restrictions and abolish tax loopholes with a largely Republican Congress. And so when you talk about containing cost and improving accessibility, well, first off, if the government's going to run it, we're not going to be more accessible. That's like asking, like, what do I do if I am mistreated by the government? I go and I sue the government? That sounds like an internal investigation because I got shot at for carrying a candy cane by a cop, right? Like, that shit doesn't happen, that doesn't happen. That doesn't happen. Internal investigations are a perfect indicator of why this won't work. Like, okay, so it doesn't work, and I'm gonna sue the government, and the government who is providing me this service is going to find itself guilty, pay reparations? Nah. Thank you for your time.
So my opponents talk about free market competition. The current system that we have has a combination of free market, public, privatized, and people who are not insured. The thing is, the private healthcare insurance companies, private insurance companies, they are really weak at their negotiating skills. That's why our costs are so high. With a government-regulated system, they set the price, they keep the middleman out of it. Something else you all mentioned were taxes. Currently, the United Kingdom, especially Great Britain, they have a single-payer healthcare system. If you were to earn $100,000, and I'm converting to US dollars in the UK, with taxes, you take about, let's say $30,000 out of your income tax. Now, I just want to point out that is comparable to the amount that's taken out with federal income tax currently. On top of that, you pay your national insurance. This is specifically for your health care and your state pension. It's kind of like Social Security. This is an additional 11%, but this occurs after tax. In the United States, let's say you have someone earning $100,000. They'll pay about $22,000, let's round it up 23 in federal income tax. Then there are other minor taxes here and there, Medicaid, Social Security. They get about $28,000 taken out. So this, with taxes, it's $8,000 less. So given the facts, yes, in the United Kingdom, they pay a little bit more in tax. But the difference is they pay nothing for their health care on top of what they pay to national insurance. $10 for any prescription, no matter how many pills. And this is a system that has been in operation since 1948. It's extremely healthy. Something else I heard from my opponents were the wait times. You mentioned the DMV, which is my personal hell. Wait times are notorious in a single-payer system, but there are strict regulations to combat this. And I want to point out, in the United States, on average, it takes 29 days to see a dermatologist for a skin exam, 66 days to have a physical in Boston, and 32 days for a heart evaluation by a cardiologist in Washington. That same study found that 26% of the 2002 American adults surveyed said they waited 6 days or more for appointments. On average, this is 16% worse than the wait times in Britain. And when it came to appointments with specialists, patients in Britain and Switzerland, countries that use the single-payer system, they reported shorter wait times than in the United States. Another concern that I know a lot of people have with the single-payer system is autonomy. You want to be able to choose your doctor. Not being able to choose your doctor, your general practitioner, the doctor for your preventative health care, the government doesn't tell you what doctor. You can choose the doctor that you want to have. Yes, specialists are assigned to you by hospitals, but you get to choose which hospital you go to. Also, doctors undergo yearly rigorous reviews to make sure that they are performing to the best standards. And they have to revalidate their medical license every 5 years. In conclusion, what we're seeing as the results is that the single-payer healthcare system creates better
a better environment for a better, healthier system for everyone involved.
Hi. So we heard a lot about, the first thing that I noticed as actually someone that's worked in the life and health insurance field for many years is that insurance companies are weak negotiators and therefore have caused issues in the current healthcare system, I suppose. But the way insurance works is essentially a piggy bank. So the people that pay their premiums in the current system that we have today is that you pay your premiums and you put the money into the piggy bank, and then when you have a claim, the piggy poops out the money for your claim, right? So it's a system that works like that. The way that insurance companies set their rates is by seeing how much is going in versus how much is going out, and if the piggy is too much is coming out of the piggy and not enough is being put in, then the insurance company raises the rates on people so that they can take on that risk, is what they call it. And so that's called the loss ratio, how much is going in versus how much is going out. So that's the reason why insurance companies now didn't always, before Obamacare, didn't allow people with pre-existing conditions always. They didn't, they would raise your rates on you if you use your insurance. It's not because insurance companies want to be mean to you, it's because they have to stay in business. And so then there's, of course, other services and things that have been put in place in other companies in order to provide care for people with pre-existing conditions, to provide even with, I won't go into the life insurance thing, but the point of that is that if the government was now under a single payer system, if the government was going to take on all of the risks in the entire country, then the government's going to have to set a price and the tax that they're going to take from people to pay for that is relative to all of that risk that they're now taking on. And so that's not going to be an inexpensive venture at all. And what we found is that, I was listening to NPR and they were talking about that the Britain plan is not our plan. It's not a single payer system. It's not the same system. This tax that is projected, this tax that would be imposed upon people in the single payer system is not projected to, as I said earlier, it's not projected to raise enough revenue to pay for itself, and we can't raise enough money elsewhere to cover that cost. There's many financial professionals who have weighed in on that, saying that the 40% that would be necessary is way too low, that we're going to need at least, the highest we could even probably raise would be like a 20% increase. So the point of that is that to think that there is a plan that we can just swoop in and make everything better by giving all the power to the government, it's just an unrealistic plan. It's been proven. It's financially and quantitatively not possible. And when it comes down to is that the government has not had a good track record as far as providing services that have had longevity and working well. And therefore, we need to give the power back to the people and allow them to make their own choices, allow companies to have competition, and allow there to be
30 seconds.
Economic equality as well. Thank you.
All right, so to clarify and reiterate a few things, once again, single payer systems do allow you to choose who you're covered by, whether you want to be public, private, or a combination of those healthcare insurance companies. Yes, the taxes may be higher, but the out-of-pocket costs for your medical care and insurance is non-existent. Let's break down and let me clarify to you how the single payer system works. One, it gives you access to preventative health care, which is something we in the US are currently lacking majorly. It gives everyone access to primary care without cost barriers and reduces how many people get sick in the first place. Just reducing this alone will save not just you money, it'll save the insurance company monies on having to pay for procedures and operations that could have been prevented had there been steps taken to make sure that the patient was cured in the first place and not just, put aside and put aside and put aside. Also allows it for early intervention. Allowing everyone to have regular source of care without cost barriers allows us to catch illnesses and injury before it becomes serious again. It reduces the insurance's overhead. Private insurance companies spend from 10 to 30% of every healthcare dollar on overhead. Public insurance, 5%. Single payer plans don't need to advertise or compete on the market, which saves them money. And then by reducing the provider overhead is also a result of single payer healthcare systems. When hospitals and physicians send all of their bills to one payer, which would be maybe a public insurance plan, they don't need a billing department to juggle different forms of hundreds of insurance companies, and each doctor and each healthcare practitioner wastes less of their time on paperwork and devotes more time to actual healthcare. And once again, the bulk of the purchasing power is another way to say that the government sets the price. Now, they said earlier that the government's going to jack up your healthcare prices. Government healthcare is actually a lot cheaper than private healthcare. And if the private system thinks that it's that much better than the government healthcare system and that it serves more people, why aren't they lowering their prices now, and why aren't they doing just that? I'd like to see a private healthcare system go out and go to the homeless on the street and pay for their medical care out of their own pocket and do what private industries say they do instead of blaming the government for lack of efficiency. So once again, the single payer system creates a more humane working environment, not just for the people who are in the healthcare company, but for its patients as well.
Okay, so I'm going to start with their argument and then go back to the free market solution. So they said tax would increase, but the cost for healthcare would be zero, negligible. So you're saying, I'm going to pay for healthcare. I'm still going to pay for healthcare, but we're going to call it taxes now. Okay, so if you call it healthcare or taxes or applesauce, it doesn't matter. I'm still paying money for my healthcare. And we've already seen the dropped arguments about how successful the government has been about providing services to its citizens in the past. So this is an argument that you can pretty much, sweep away. Second, they argued that it reduces the need because of preventative care. Wait, what? How do y'all regularly go to the doctor under your current healthcare provider, whatever, for preventative care? No, you don't. That's a social issue. That's not a government going to mandate our behavior and then solve problem issue. These are not corollary. Preventative care is about eating right, is about taking a walk instead of driving your car. It's about getting enough sleep. It's not about government putting a plan into motion that says you must behave this way, or you must see the doctor now, or you must see the doctor then. We have enough government in our lives. Let's get government away from our lives. They also said that the single-payer system has less overhead than the for-profit companies. I'm going to say no. That's flat out a lie. Do you realize how high the government overhead is right now? They're not for-profit. They have no consumer base to answer to. They don't go out of business if they stick us in 45-minute DMV lines like Starbucks or like Amway or like any of the other corporations that are for-profit do. They're inherently wasteful because they have no market to answer to, period. This is total nonsense. This is a lie. The fourth point that they brought up is that doctors would spend less time on paperwork and more time on clients. What? So the government's now going to mandate paperwork for doctors? Okay, so let's intrude further into private business, and that's going to increase efficiency. How? Their fifth point was that the medical care for the homeless is absent. Well, let me tell you something. In the 1960s, the medical care for the homeless was available free of charge through a multiplicity of non-profit, funded by the Catholic Church hospitals. The doctors got paid $1, but you know what? They are almost non-existent now because they lose their tax-exempt status if they prescribe prescription medication without charging. This is once again government saying, well, wait a second. I'm getting paid by the pharmaceutical companies to make sure that they're insulated and have a monopoly and they maintain their hold on the marketplace, so I'm going to make a law saying that you can't. So once again, back to the definition of insanity. We want government who has already done this to help fix what it's created? Like, no. We need other actors. We need a free market that doesn't have to answer to bureaucracy, that has to answer to the consumer. And what happens in free market? The prices go up, the quality goes up, or the prices go down, the quality goes up because of competition. When you're talking about government monopoly on healthcare, that means one system, right? We have to buy our gear from that one company, no matter what quality of gear that is. This is not going to drive prices down, this is going to drive prices up, because what happens in monopoly? Monopoly, prices go up, because there's only one game in town.
1 minute.
Going back to the free market solution, we've already showed how the insurance companies are not weak negotiators, and the government is going to help bolster their negotiation power. We've already shown that they contain costs by focusing on their number one, profit, and they provide services, and if their services are not good, the clients go elsewhere. We've already shown how NPR says this Britain Social Security-esque thing is not the same thing that's being proposed in this country. So they're not synonymous. They're not even like each other. In Britain, they don't have pharmaceutical campaign funders. We do here. Once again, back to the workability argument, which they didn't even argue. They didn't even talk about how they're going to get this through Congress. They just said, well, it'll magically happen. That's not how our government works. It has to be like passed by Congress, right? And it's not going to happen, so that is my time.
Thank you.
Something that both sides can agree on is that our current healthcare system has failed us. It's highly fragmented, with some people belonging to private insurance plans through their workplace, others getting public insurance plans such as Medicare and Medicaid, while millions others lack health insurance altogether. The Affordable Care Act was a step in the right direction. It reduced the amount of uninsured from over 13% of the population in 2013 to less than 10% in 2015. Those numbers are record lows, but that's still close to 33 million uninsured people, a disproportionate amount of whom are poor, Black, and Hispanic, and a disgustingly large number of which are children. A privatized system treats healthcare as a commodity rather than a right that was explicitly stated in the United Nations Universal Declaration of Human Rights. According to the Organization for Economic Cooperation and Development, the US spends 17.1% of its gross domestic product on healthcare, almost double what was spent in the United Kingdom at 8.8%. Yet, with all this spending, we see poorer results with a life expectancy that's shorter than 28 other countries in the world, including Jordan, and the highest infant mortality rate of the richest countries in the world. Single payer is the best option. It reduces overhead. Private insurance companies spend from 10 to 30% of every healthcare dollar on overhead. They are advertising and trying to compete rather than working for the patients. Hospitals and physicians have billing departments that have to juggle hundreds of forms for all the different insurance companies. Speaking on the homeless, in the 1980s, President Reagan, he cut federal funding to homeless care and care for the mentally ill because he thought the homeless were lazy. How can a private system fix that? The government sets the prices to make sure that there are no middlemen over there overcharging patients. I understand our opponents are scared because they raised some great concerns about single-payer healthcare. Yes, given the facts, the UK does pay more tax. But the point is that when someone goes to a hospital, the last thing that they are worried about is whether they can afford healthcare, because you know what, they can. Without those extra out-of-pocket expenses for prescription and emergency care, they have peace of mind because they know that they'll be taken care of and their loved ones aren't burdened with thousands of dollars in medical bills. On average, the wait times are worse in the US than Britain, 16% worse in the US than Britain, and appointments with specialists are reported shorter in the US and Britain in Switzerland rather, in compared with the US. And once again, you can choose your doctor and whether or not you want to go to that practitioner. The option is open regardless of what income you have. The truth is, allowing everyone to have a regular source of care without cost barriers allows us to catch illness and injury before it becomes serious and expensive to treat. Giving everyone access to primary care reduces how many people get sick. Or when they do get sick, they can go and they don't have to worry about all those extra bills. With the single payer system, I think you talked about the doctors. You said it was a lie that the doctors won't have more time. But the thing is, doctors spend a giant portion of their time filling out paperwork for all those different insurance companies. With this, that's taken away and they can really focus on the patients. As of right now, the market system forces millions of Americans to make a decision. That's one between buying food and buying medicine, taking care of other necessities or taking care of themselves. A single-payer healthcare system eliminates this choice by guaranteeing quality, affordable healthcare to all people, regardless of income. Thank you.
Hey, so I have a question about, for healthcare, are you guys advocating for something similar to the VA system? Because the VA system offers free healthcare to all veterans. However, they don't treat veterans correctly. Many veterans, they don't get the service they need. I hear lots of stories about veterans who have to wait years, even after their death. And 10 years after their death, they finally get called up because they have a slot. How do we prevent this in a single payer system in the United States for average citizens?
Is this on? So, can you hear me?
Yes.
Okay. So yeah, the VA system is flawed. I have personal experience with the VA system. It is not efficient and effective. But what we are advocating for is the single payer system, very similar to the national health system that's in place in Britain and other industrialized countries. And so the thing with these countries is, I know we mentioned briefly about a wait time. They have the NHS has a very regulated wait time for those who have, let's say, a more pressing concern such as cancer. They must be seen within 2 weeks. For other systems, there are. For other concerns, it's an 18-week wait, which does seem long, but once again, this is, it's comparable to what we see in the US. So with this, all systems are flawed. That is true. But we've seen success in Britain, and that's a system that's been in place since 1948.
And I think maybe the reason why the VA system might be so flawed is because, again, since we have a very layered health insurance structure, it's a lot more difficult to organize. And so when you have something like a single payer system, it's all in one place. And so it's not like they have to talk to different specialists or something like that to meet the person's needs.
I have two questions. The first one, and I want both of you guys to answer the questions. So the first one has to do with if you all think there is a right to health. That's just a question, and I think that's a good idea to understand if even a government or a private should offer it. If citizens deserve to have a health insurance just in general. That's my first question. My second one has to do with, unfortunately, I don't hear a lot of criticism from the libertarian when it comes to corporate tax. And in the US, the government gets individual and corporate tax, but the individual tax tends to be higher. So if we're going to deal with improving healthcare or improving higher education, how are we thinking about balancing them out or increasing the corporate tax than it is now, or even probably?
I don't think we do have a right to health care. We have the right to choose to live our lives in a certain way, the way that we see fit. We have a right to be not aggressed against. But no, having a right to health care is basically equivalent to me saying that I have a right to your car's tires because it's a right. That we don't have a right to commodities. We have a right to choice, we have a right to freedom, we have a right to liberty, and we have a right to equality, and we have a right to be free from violence. Though we don't have a right to health care. The second, do we increase the corporate tax? Man, if we could get taxes down to zero, you know how peaceful the world would be? Like with no money going to government that creates war, you know how peaceful the world would be with zero taxes? Like, nah, I think we should get the taxes all the way down.
And that being said, that as he did say though, I believe we do have a right to equality, and with that is equal access to healthcare. So with that, it's not exactly that healthcare is a right, but it's that we all have equal choices and equal actions. And with the cost of healthcare increasing, especially at a time when so many families are struggling just to get by paycheck to paycheck, to raise the cost of health insurance, to me, does not seem like something that is creating an equal environment for American citizens at all. Yeah, that's all I'll say for right now.
All right,
No, we didn't get to answer.
You want to go?
Yes, sorry, to answer your first question, yes, all people do have the right to health care. Everybody likes to quote John Locke, so that nobody really knows that John Locke was actually misquoted in the Declaration of Independence. John Locke originally said that all people had a right to life, liberty, health, and property. The founding fathers just liked to leave out the health part. So, from the man who founded essentially our nation's ideologies, health is supposed to be a guaranteed right.
I'd like to add to that too. At the foundation, when the United Nations were founded, they came up with the Universal Declaration of Human Rights. And this, the former First Lady, Eleanor Roosevelt, she was very heavily involved in this, and I just want to read Article 25. And this is something that the United States has signed off and pledged to protect. Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, and other lack of livelihood in circumstances beyond his control. Healthcare is a birthright, not a luxury based on your income.
Yeah. All right.